today's Newham GP Forum on this Friday afternoon. As you can see, I'm not Nadeem, but I'm going to be chairing for most of the meeting today, just because there are people on annual leave, and now that we're sort of coming into the summer term, we will be kind of having some people that are on leave, and today we've kind of shortened the agenda just to reflect that as well. And I can see there's not as many of us on the meeting today. Just to remind everyone that the meeting is being recorded. And if you do have any comments or suggestions, you can either use a chat bar, or also please also put up your hand. This is a forum for us all to get involved in, and I welcome everyone to kind of hear your views as well on the agenda items. So to begin with, we've got our first item agenda is from Sule and Dr. Yasin. So really good news yesterday, Sule. I was on the GP trainers group, and such good news that we've got over kind of 10 people that have been newly qualified to become a trainer. So brilliant news for Newham, and I hope that we can kind of continue that momentum. So over to you.
Thanks so much, Rima. Yes, brilliant news. You can see on the slide that we are really pushing forward with the Newham approved learning environments. We are actually approving our practices to become learning environments, as well as we are approving our trainers as approved educators and trainers. 23 out of our 44 practices are, so it is half and half really, approved learning environments. So any practice who is interested in becoming a learning environment, multi-professional learning environment, I like to add, please do get in touch with us. There is a website as well. You can see all the information that you need for this. But what I do, usually I have one-to-one meetings with the practices and go through the forms and documents, and we provide that one-to-one kind of advice and guidance to all the practices. And for our educators, we have 11, and there were a couple more yesterday actually who are interested. So we are actually working with those individuals as well. So yes, we are really kind of pushing forward with this. In the next slide, what I wanted to put in and bring to your attention is the NHS long-term workforce plan, which is published recently, has got a huge kind of link to this work in terms of train, retain and reform. Those are the three big titles, as you know. You most probably had a chance to look at the workforce plan, but I just put it in here so that you can see the link, that why we need to do this in Newham, and hopefully get all our practices to become approved learning environments, so that we can actually bring in people and expose them into primary care, our GPs, nurses, physician associates, and we can train them in our practices and make sure that those environments are most kind of supportive environments for encouraging people to stay in primary care. I'll leave it at that and I'll hand over.
Okay, thanks, Sule. And it's Dr. Yasin, isn't it?
Yes, it is. It is. Hi, Rima. How are you?
Good, thank you. Right.
So my name's Iram. There's actually two Irams in Newham. I think there's an Iram Ali as well at Project Surgery. I'm not that Iram, so I'm really sorry to disappoint anyone that was expecting that one. I'm the other Iram that's newer, I think. So I started working in Newham in 2019, and I'll talk to you a little bit about my journey as a GP trainer. So I joined Newham Medical Centre, which is opposite the old West Ham football stadium, in 2019. Prior to this, I was working at a surgery in Essex, and there I was working sort of informally with GP registrars and with medical students. And when I started work, when I moved over to Newham Medical Centre, teaching was something that I was really passionate about, and I really wanted to move towards getting the practice approved as a training practice, which it wasn't at the time. I also did my GP training approval at the same time, so I started the ILA course in 2021. So the ILA stands for Introduction to Supervision and Learning Assessment for Primary Care Professionals, and that sort of replaces what used to be the TTT for GPs. It's like 10 online sessions with small group and large group work, which leads to about 40 hours of CPD work. and I completed that in 2021. I actually really enjoyed it a lot more than I thought I would. It was really interactive, considering that it's online. So I think that's a great course to do. It takes us, yes, there is a certain amount of time out of practice, but actually I found it really relevant. So once I'd completed that in 2021, I moved forward to help approve the practice. And I think the thought of that is far more daunting than the actuality. And there was a lot of support out there. So Sule was great in supporting us with that, supporting us with what looked like was a really complex form, but actually once broken down, it wasn't that difficult. Our local TPDs were really supportive, and basically anybody that I spoke to about wanting to be a trainer, anybody that I mentioned it to, was really supportive of our process. And really importantly, especially our practice manager Sunita, she was really supportive, as well as the partners. So we got our approval in 2021. We currently have 3 GP trainers and 1 GP that's almost there, so she's just at the end of her approval, so we should have another trainee by February. We've had as a practice, we've always had medical students, so the teaching ethos, I think, has always been there. Since 2021, we've had an ST1 and an ST2, and it's really, it's been really great, and it's been great for the surgery. The other thing that I did after getting my approval as a GP trainer, and I think I would recommend this to a lot of people, is that I've attended some of the VTS sessions. I got to meet the TPDs and got to know their way of working, but also got to know what the trainees are doing on their days off, and how that reflects what we do in practice. So if anybody's interested in wanting to be a trainer, I think that's a really good starting point. I think it's a really good idea to attend those, and Shanaz and Osman and Lak, who's not there anymore, but they're all great in supporting that. So if we move to the next slide, I'll talk a little bit about why I wanted to be a GP trainer. Mainly because I'm probably quite sad, like a lot of other GPs out there, in that I really love consultation skills. I really like working with the adult learners. I'm a really big fan of Roger Neighbour. I clearly need to go and get a life, but that's what I love. And I think really becoming a GP trainer is a really natural next step for GPs, and it becomes very natural to the skills that we already have. For me, it was really vital, and really it's been really interesting so far to be involved in shaping the new GPs and the GPs of the future, and actually seeing the difference between where they're at ST1 and moving through that into ST3. I think it really helps to balance out the clinical and non-clinical workload. So you have the days where where you have your tutorials, there isn't a clinical session, but is a really useful session for myself and my trainees, and often I find I'm learning more than they're learning, and they keep you on your toes, and they bring lots of new information. I think in terms of longevity as well, I wanted to be involved in something that will reduce burnout. At the moment, I still really love general practice. I really enjoy what I do, but I wanted to make sure that I instilled something within my working week that keeps that going, and reduces, the burnout, and keeps me motivated for what I'm doing there. And the other thing was that I felt like I knew that I could, because, like I said, the partners at the surgery and the practice manager were really supportive of that. So that all really helped. So why do I think we should all be GP trainers? If we just move on to the next slide, what are the benefits, and what are the challenges? So I think it's been great to have a fresh, new, dynamic face at the surgery, a new name on the board to have a birthday cake for in the year. I think it's great to have that. As I mentioned, I really do think it does lead on very naturally from what we normally do, and our natural skills of listening and working with. It's just like working with another team member. I found that it's really improved our team cohesion. So we already have a coffee break instilled at the surgery. At 11 o'clock, we all come out of our rooms and we'll catch up on, yes, lots of cases and complex cases, but also what we did on the weekend, and if people are going through difficulties, and where everybody's at. And I think that was even better with having a new face at the surgery. yes, there's an element of service provision, but also more importantly, an element of retention. So, you know, the trainees staying on maybe at the training practice where they train, but also generally staying in Newham, and staying in London and the UK, because, you know, we're going through a difficult time, and I think that really does make a difference. I think it's been really useful to have kept in touch with general practice training and education and where it's going, and with the Newham VTS. There's lots of support, like I said, from the TPDs and from the trainers workshop. The little bit at the bottom, the 14 fish, actually what I meant that as a reminder to me was, I know a lot of people are apprehensive because they're thinking, well, how can I teach when I'm not sure? There's a lot of apprehension about what they're going to teach. What am I going to fill my tutorials with? I don't know the first thing about this 14 fish platform or CBDs and COTS and all the rest of it. And what I think is really important to say is, firstly, there's a lot of support there for you. So I certainly don't know everything. I am pinging Shanaz messages in the evenings, on weekends, about COTS and CBDs and ESRs, and they're really helpful, and they really do guide you through it. 14 Fish, the learning platform that the trainees use, is actually quite easy to navigate. Even for me, who doesn't like techie stuff, I think it's been really easy to navigate. Yes, it's a new platform. It's not something that I was familiar with. I didn't have it when I trained, but actually it's been quite smooth and easy to use. It hasn't caused any issues, so that's really good. And with the apprehension around tutorials and teaching, I think what's really important is that we remember that we have adult learners. We're not responsible for their learning. They're responsible for their learning, actually. And if they do want to have topic-based teaching, I always reflect it back to them. They'll go and do their bit of research, bring back some topics that we'll talk about, and we'll either brainstorm or go over it in a case-based manner. And then what I instill is what I have from my experience as a GP. And actually that's something really important, because it helps reinforce the knowledge that you have, which again is really positive, to remember that as a GP we do know things. Because at times at difficulty like this, we can just feel like, I'm not sure if I know what I'm doing here. So actually the trainees can help reinforce the knowledge that you already have. So the tutorials aren't as daunting as we would think they might be. We're not responsible for their exam preparation. Again, that's something that's on them. But what we can help them with is making sure things are smooth in terms of helping them with their videos, helping them with their clinics, making sure that their time is blocked out, and all of that is organizational, as opposed to really heavy weighted on you. So overall, I think I've just found it to be a lot easier than what I thought it would be. I've met lots of new people in the other trainers. I found that there's been a lot of support. I think it is important that you have good team support, good organisation in place, and a good practice ethos to start off with. And if you don't, it might help to instill it. So I think that overall, we've had a really good experience. Now the final slide is just something for you to look at. I thought you don't want to hear everything just from me. What I did was I asked our team to give me a couple of words to describe how they found the experience of being a training practice. So when they finally figured out that I wasn't asking them to talk about the trainers, to talk about the partners and talk about the consultation skills, or to talk about how they thought what they thought I was like, when we finally got it nailed down to what the actual question was, these are the thoughts of sort of our admin team, the other GPs, the reception staff. So I think overall it has been a really sort of rewarding experience for everybody involved. And I think that, and I hope that anybody out there that wants to be a GP trainer goes for it. I'm happy for anyone to speak to me about our experience if that helps. Thank you.
Thank you so much, Iram. That was really kind of inspirational, and I'm really hoping that kind of motivates more people to think about it. I mean, certainly when I've approached people and asked them, to think about becoming a trainer, I think one of the two things is the training was too long, and I think it's better now that actually it's all condensed, and that makes it a lot easier to become a trainer. And also, time. But I think it's about incorporating this into your normal clinic daily lives in the surgery. And as you've outlined, there's just so many positive things about it. And thanks for the offer for anyone who's interested. in becoming a trainer. I think it's so important for Newham and our, future of Newham, of retention of GPs. Iram's obviously offered to speak to anyone, so please get in contact with her. But thank you so much. Yeah, really motivational. Before we go into the next agenda, was there any questions anyone want to ask Iram or Sule? Anything about that? Anyone who's thinking about maybe becoming a trainer, is anything you want to talk about today? No? Okay, perfect. Thank you so much to the both of you. All right, let's go to the next agenda item. So we've got Hayley, who's kindly come to the webinar today. He's going to talk about exercise on referral. So over to you, Hayley.
Hello, can everyone hear me okay? Yeah, lovely. So yeah, I'll just introduce myself. So my name is Hayley. I am the new Healthwise coordinator for QEOP. So that's the Queen Elizabeth Olympic Park. And yeah, we are relaunching our Healthwise referral scheme. Healthwise itself is sort of an umbrella term, whereas our PARS programme is part of our Healthwise referral scheme. So as part of PARS, what you can do is you can refer patients to us, and we will then provide them with a 12-week programme, which it aims to introduce them to exercise, introduce them to physical activity, to help them to manage their medical conditions and hopefully reduce the risk of long-term medical conditions as well. Over the 12 weeks, they'll get support from us, and we'll try and motivate and encourage them to continue exercise, and we'll sort of progress their exercise programme over that 12 weeks, whether that's in the gym, whether it's in the pool, whether it's at classes. So yeah, we're really trying to motivate them to exercise and give them sort of encouragement to exercise long term. Sorry, if I could just get the next slide. Lovely. So our referral form is now live on EMIS and on System 1. So for those of you who, I think probably a lot of you probably familiar with Healthwise from back in 2019 and previous to when you referred, but if you're unsure, then this is our Healthwise referrals form. I've changed it a little bit for the relaunch. I've probably added a few other bits on. So now there is referral for lower back pain. So if you've got any patients who are suffering from lower back pain, again, that's a reason for referral. So the referral form, like I said, is on EMIS and System 1. If you are using another platform, maybe Rio or a different one, just drop me an email and I can get that referral form sent to you. But fingers crossed we can get it on those platforms as well as time goes on. Please, if you can, just put as much detail on there. So obviously we need a contact number or an email for the patient so we can then contact them nice and easily. So ideally one of those would be fab, and maybe a contact number for you guys as well. So the referrer, a lot of the time the referrer emails that form to us so we can then email them back if we have any issues. And yeah, pop down their reason for referral so we know what to expect when they come in. And if there's any other medical conditions that maybe there are exercise considerations for that we need to then take into account, then again, we can do that if you pop it down. A reason for referral would be brilliant as well. So I think that's probably a little bit of what the patient wants, maybe what you guys want them to achieve. So just write down very briefly what you think would be really good for them as a goal. And then we can talk about that in our initial assessment with them. At the bottom as well, we've had quite a lot of questions about the consent. So obviously if it's a digital version, then don't worry too much about it. As long as you've had that conversation with the patient and you just write at the bottom, patient gave consent. You know, if it's a digital version, don't worry about signature. Same thing for the referrer as well, just pop your name down. I don't want it to be a problem in terms of referring to us, so just make it easy for yourself. On the back of that form that will be on EMIS or in System 1, or I can get a paper version to you, there is an inclusion exclusion criteria as well, which is quite vast. So for example, if you were referring for anxiety or depression, there's an inclusion or exclusion criteria for that. So it has to kind of be mild to moderate anxiety and depression. It's up to your discretion as to whether you think that they're going to gain a benefit from the exercise program. If you think they are, then probably they're okay to be referred. So yeah, just make sure that they're fitting that criteria as well. But it's quite a vast criteria as to how you can refer, who you can refer. But if in doubt, just refer on, and then we can make that decision at the initial assessment. If I get the next slide, please. Lovely. So in terms of our pathway, we'll receive that referral from the clinician. We'll triage it, make sure that we're happy with the referral. If we need to get any more information, we can go back to the referrer, and then we'll get them in for their one-to-one initial assessment, which is an hour and a half with us, with one of us, one-to-one, and we'll talk to them a little bit about what they want to achieve, what facilities they want to use at one of our centres, and we'll also do a gym induction with them. So we'll go through some equipment in the gym, and we'll create them an hour programme or a 45-minute programme or half an hour programme, whatever they feel that they can manage, which will then be their sort of go-to programme for the next couple of weeks. We'll then check in on them every couple of weeks. At week 4 and week 8, we will then do a review and a final week 4 and week 12, we'll then do a final assessment at week 12, which again will be a one-to-one appointment with us, and we'll then sort of tailor their exercise program, maybe progress it, regress it, change it up if they want to, and then we'll give the referrer a note back after the 12 weeks just to say this person is going to continue with the program, continue with their exercise, what they've achieved, have they achieved their goals, and if, what's their plan is going forwards. During the 12 weeks, they can access all of our facilities, so that is part of their membership. So they can access two supervised gym sessions with us a week. So they can come to our supervised sessions, which is where a small group of individuals will meet. It's a bit of a social, and we can then sort of go through some exercises with them. And they also have access to the pool, our gym-based and class facilities and sessions, and also our water-based classes as well. If I go to the next slide, please. Thank you. So I think just probably inclusion criteria, sort of the basics of that, is they have to be over 18, they have to be a resident of the Olympic Park or the surrounding boroughs. Now, we're quite lucky with where we are, so we can accept Newham, Tower Hamlets, Hackney, Waltham Forest, Dagenham patients. So if those people have got home postcodes in those areas, or they've got GP surgery in those boroughs, then they can be referred to us. So again, if in doubt, just refer to us, and then we can sort of distinguish what postcodes we can't accept, but normally we will accept them. And they have to be sort of ready to change. So you have to have that conversation with them as to whether they think that they want to change, and they're happy to exercise. If they're unsure, again, just refer them on to us, and we can then have that conversation with them in the initial assessment. And then on the right there's our inclusion criteria as well, which is on the back of that referral form. Brilliant, thank you. On to the next slide, please. Lovely. And then just to note, I'm running out of time. We've got our Healthwise, thank you. We've got our Healthwise email. So once you have completed the referral form, if you could then just send it to us via our Healthwise QEOP email, which is our secure email address, and then we'll pick it up. We'll drop you a note that we've received it, and we'll then take it from there. We aim to get the participant in 2 weeks. So they'll be contacted, they'll be triaged, and they'll be seen within that 2-week period, and then they'll be started on their 12-week scheme. They'll come and see us, and then they'll decide whether they want to join the scheme. They don't pay for our services, they pay for the gym itself. And just to make you aware, it's £25 a month for the gym, or they can do pay as you go and use the gym facilities as much as they want to. Our normal membership is £55, so it's quite a big discount, and they can use our London Aquatic Centre, so all the facilities here, and the Copper Box Arena as well. So depending on where they are located, they can use either centre. I hope that makes sense. Has anyone got any questions?
I think thanks, Hayley, so much. There's a lot that you covered there, and it's a good reminder to, that the service is available. I think we all tend to forget when we just say bombarded with so many different kind of forms and things like that. So in general practice, for many of us, usually our social prescribers have interactions with our patients about things like this. So I wonder whether you've gone to any social prescribing forums. Otherwise, we all pass it on as well to our team members.
Yeah. So I've been in contact with quite a few of the social prescribers. I was at a social prescriber event yesterday, and yeah, I've got a group of them coming over to do a tour of the facilities as well, so they know what to expect and they know what they can tell their patients. So yeah, I definitely have made contact with them. But if there's any other events that, you know, if I don't know about, then yeah, send them my way and I can get them blocked out in my diary to go to. Because like you said, yeah, we're on the Joy platform as well, so we've managed to get our referral form onto there, so they can easily access our referral form to send them over via Joy. So I know that's normally what the social prescribers use. So yeah, definitely we're in contact with them and the health and wellbeing coaches as well, and they are really, really good contacts for us to have.
Okay, thanks, Hayley. I've got a question from one of our GPs. Claire, would you like to come in?
Yeah, no, great to have this update. It's always been a really valuable service. You said it's a free service for 12 weeks. Often our patients then are concerned about how they continue the work. So are there any funding packages for low income? Because it's a real challenge for some of our patients to then continue their activity after the programs.
Yeah. So the reduced membership lasts for 2 years. So they can then access our facilities for 2 years at the same rate. So yeah, they can continue doing pay as you go, or they can do that the £25 as well. And yeah, as long as they don't cancel it, and as long as they complete the 12-week program, they are eligible for the 2 years at that same rate. Yeah, so absolutely. I know we've had a few referrals through as well for people to be funded via different means. So as long as the program, the 12-week program, is funded by any means, that we will accept it. So I think, for example, the mental health team have referred, and they're getting funding elsewhere, and absolutely that's fine. It doesn't have to be that the patient pays for it, if that makes sense. But yeah, no, it carries on for 2 years, that funding.
Thank you.
Thank you.
Any questions from anyone else for Hayley? No. Okay, well, thank you so much for coming and reminding us of this. And I think we all just need to try and make sure that we are trying to capture these people that will benefit from the service as much as possible.
Brilliant. Thank you very much for your time.
Thank you, Hayley.
Bye.
Bye. All right. Next up is Will. I know because he's turned on his camera. Hi, Will.
Yeah, sorry, you don't want to be looking at my face when you're obviously. So I haven't got any slides for people, so it's just obviously it was more of a quick update of where we're at. So I'm going to just cover just obviously the ICB restructure, some feedback, just high level feedback on the capacity and access plans for the PCNs that have been working on. So thank you for that and they're supplying those back. Just a quick touch base, just to check with everybody that TQuest is now back online and working, because obviously was an issue yesterday, but that was a national issue, so I've covered that off. And then just some recent emails that have come out around the transformation and modern general practice plans and kind of the funding that is associated with that, but also the email around immunisations around measles. And London's obviously on that, so I'll just kind of touch base on some of those. So just on the restructure, so just to let everybody know, obviously the ICS is going through a restructure, as it feels like it always is, but until this time there's a 20% ask. So it's really just to kind of bear with the team. Obviously there's quite a lot of vacancies we're holding, but really just there'll be quite a lot of people that will be displaced and moved about. So the 17th on Monday, people will actually see the final structure, and that will follow through with people being kind of moved around and having to apply for jobs, etc. So again, it's, you know, kind of bear with the team and yeah, be sympathetic, I guess. Be kind. That's what we need to show each other. So yeah, so just to think through. But if there are any issues, then obviously to flag them to myself, Ruth, Layla, or Atlas, that would be really helpful. Just on the capacity and access plans, like I said, again, thank you for those that have submitted those in. Just really, I think the teams have been giving feedback to practices and to PCNs anyway, just on where the gaps were. So certainly on majority, some of the plans we hadn't really covered off the telephony based, so the cloud-based telephony and what the plans were for that. what we're trying to do is not make it a tick box exercise, but actually really thinking through, you know, what does it mean on the ground. And I know we've got a workshop certainly around access next Tuesday with the CDs, but it's really just to kind of have a wider conversation of what are those capacity and access plans, how do we reduce the bureaucracy, what do we need to put into place to work with yourselves on doing, etc. I'm just trying to get the other feedback from the team, but it was around cloud-based telephony mainly that was coming through. Sorry, bear with me. When I look at something and then it goes wonky. So yeah, so cloud-based telephony, just around patient experience was another area, and just around kind of the baseline data of obviously which we want to be able to provide practices and PCNs around kind of where they're at with their kind of various stats, you know, patient experience, friends and family, those kind of online usage, GPAD, etc. And then just like I said, is using kind of Eden Bridge where we can. And again, if PCNs or practices are worried about kind of their plans or haven't seen them, then get in contact with getting distracted with the pings. Get in contact with Ruth and Solma. So yeah, so we do it exactly right, Tammy. So again, there is obviously the ask of again, getting the EMIS Enterprise in, so there has been that offer to PCNs for a small amount of money to be able that interoperability between practices and PCNs. And when the ICB gets the funding from the SDF, we're hoping to refund that 5,000. So hopefully, if you can just check that actually you guys have signed up to that, because that will very much about the IT appropriateness of moving work around or supporting each other, and that for me is around general practice kind of sustainability really, kind of going forward. Just on TQuest, hopefully everybody's now back online, so apologies for that was a national issue. But again, is what I would say is, I know obviously I'm not on the WhatsApp group and I don't want to be put on the WhatsApp group, but actually if they can let people know, and actually because then we can pick it up, because I know it was obviously feverishly going on in the world of the WhatsApp groups, but actually would be good to let the commissioners know as soon as you can, and then obviously we can pick it up like we did. Again, the emails that have come out around the transformation agenda from, again, that can be copied around the transformation cover and transitional support funding to move modern general practice access model, and there's funding in there, but also dates in it. So please, again, is obviously in the email that's come out from the central team. Don't worry about the dates at the moment. We are clarifying that with a NEL kind of process. So again, as I know there's a bit of confusion because there are national dates, and then obviously we've done a NEL conversation. So actually they're going to just confirm what the dates will be in an email. So panic not. It's a 2-year program, and we'll need to come back with some very clear of what and how once the team have worked that through. And then lastly, but not least, obviously you'll have seen this is as with anything, schools are breaking up, aren't they? You know, next week or the week after, really, really clever. So obviously there's been now a focus on measles, and actually it's the school age children, but also 30-year-olds, where actually potentially the whole kind of Dr. Wakefield kind of legacy is now starting to come out, where obviously within Newham and Tower Hamlets and Waltham Forest, we do have a lot of diversity and cultural makeup of people visiting and coming from overseas, potentially with measles and haven't been vaccinated. And actually we are seeing a resurgence in measles in much older adults. So it's very much about how do we looking to put processes and systems into place to kind of cohort and identify those. And like I said, there's an email come out from the central team. So again, just it's really to give people a heads up. I've not yet gone through it to understand it and kind of digest it, but I just obviously not losing the opportunity to be on this forum to mention it. But again, bit of a canter. Very happy to take questions. I know we're running early, so if you've got a couple of minutes, if you want to grab me, then please do. But yeah, that's kind of my update, if that's helpful.
Okay, thank you, Will, so much. There's a lot obviously that you've spoken about. I'm going to open it up, and I'm hoping there's going to be some questions for you. I know there are some
nice questions. Yes,
nice questions.
Cara's going to give a quick update on the MMR stuff. All right, perfect.
But yeah, we've got Cara coming at after
great.
on the agenda anyway to give an
Apologies,
update on that. Any questions, comments from anyone? This is your time. Will's here. So
I'm sure people know where to find me anyway.
yeah.
But again, as you know, like I said, again, thanks for getting plans in. I know there's lots of deadlines and people are juggling everything, so I'm just acutely aware of that as well. And but again, the team are there to support, so do reach out. But again, just be mindful people are maybe not on their A game just because they're worried.
That's great. Thanks, Will. Just I put a comment in there, and Karen did as well. Just around the restructure. Obviously, I've emphasised it with Nell as well. Just making sure that we try and get that kind of strong primary care commissioner group.
Yeah.
Obviously, things it's hard to recruit to, I know, but it's just making sure that we try and have that in the restructure going forward. And obviously, you're extremely stretched across the other boroughs, so it's just making sure that we've got people and faces that are visible that we can go to with things when things arise.
So the 17th I'll come to Karen in a minute. So the 17th the actual structure will come out, so actually people will see what posts are still standing or not, as the case may be. I think most of the posts or most of the staff, because we've been carrying quite a lot of vacancies for a reason, have actually been able to be slotted in or ring fenced to roles, which is a good news story. But we will still go into the new world, certainly post September, potentially with vacancies. But we are supported by some really good interims that will hopefully stay on anyway, just to cover off. And then we'll be able to give out a kind of, right, there's the head of primary care, and then here are the other go-to. So as soon as we get kind of names on, or bums on seats, names in jobs, then we'll be able to share that and actually contact. But please use the TNW inbox. That's still there, and that's picked up by the team. And obviously, Ruth, myself, Solma, Layla, Aklas, again, do email us. We're not going anywhere, not that I know of anyway. Just too soon. So yeah, do reach out.
Okay, thank you, Will. Karen.
Yeah, you sort of touched on it. Well, I just wonder, is there a timetable of when the new group will be confirmed, such as it is? So obviously this coming week you've got the kind of first stage, but is there a kind of end point that
we hope so? Yeah, I mean it's meant to be September, so actually with a view to getting the full kind of system up in by October, but I still think we're going to have vacancies is the reality. But ultimately, the first kind of cut is the 17th. People who are slotted in will get letters. For those who don't get letters, you will be then ring fenced and then have to apply for your job. So for me, I have to reapply for my job, and then once I go through that, then either I get the job or I don't, and then I've got to be put into another ring fence and go forward in that. So I think it's the 17th. I think the 17th, the 24th. There are some key dates, and again, it's not a secret. There is a semi timetable that we can share if that's of interest to people, but ultimately it'll be this Monday, next Monday, with a view to getting kind of a lot of the interviews done hopefully in August, which again is holiday time, which is a bit bonkers, but it is what it is. So I'm hoping in heart is by the September 4th deadline we will know people and borough coverage. It may not have the full complement of staff, but we will know the go-to people. But again, I think we're not going to just. I know the places are very focused on the borough and the place. There's not going to be enough resource for all of us anyway, so we will have to multitask across the TNW, BHR, and so we'll have to dip in and out. But actually, it's just keep with the names that you know, and if they can't help you, then obviously we'll facilitate that for the wider conversation anyway.
Thank you, Will. Any other questions? Comments, Tammy?
So just a quick one. So it's sounding awful, but I suppose for us it's about the projects, the interventions, the funding, just making sure that we've got sight of that. So with the handovers, because what we don't want to do is to lose the progress that we've made in discussions, or practices don't know who is going, what the decision was and whether it's been made or not. So kind of a kind of a log, I think would be quite helpful, because what I'm finding, and switching hats, diabetes hat on it, there's some things that you think have been agreed, and then we find out that they haven't. So it's quite risky. It feels really risky at the moment. So just highlighting that.
Yeah, thanks, Tommy.
Good luck, Will.
Totally agree. Yeah, cheers. No, but it's joking apart, I think that's exactly right. We have got a log. And actually been able to, where, like I said, like certainly some of the long-term condition stuff, we thought we had kind of landed stuff, and then it's like, hold on, no, this wasn't done or that wasn't done. But again, it's like I said, is even if people are displaced, people are still in the system, if that makes sense. So actually, it's not, sounds terrible, it's not particularly pleasant to go through. However, people are still in the world of employment, and actually, even if you are made redundant, whatever, there will be a 6-month period anyway that people will still be around. So I hope those balls aren't dropped. And if you are aware of programs or projects that haven't got a focal point, then again, do get in contact, and I'll try and land them where as best I can. But again, it's the decision making of then who is our next issue that again we're hoping to clarify as well.
Okay, perfect. Thank you so much, Will, for your time today. And have a good weekend. Okay, perfect. So let's move on to Cara. I can see Cara's joined us. Cara, would you like to introduce yourself to everyone? Because I'm not sure everyone knows you. And I know Cara's going to talk to us about the progress with vaccination. Obviously, Will's kind of already mentioned that the cases of measles are exponentially going up. So yeah, over to you, Cara.
Yeah, that's okay. I think I've got some slides that I've given to Steph. I'm Cara. I'm a paediatric nurse by background. I've got both acute experience with operational and clinical work. I've just completed an MBA through an apprenticeship programme with my previous trust. I've been writing business cases, implementing new projects. I've done some focusing work on healthcare and leadership, and some stuff around patient safety and investigations with the HSIB programme. I'm now at Newham Health Collaborative to support and lead on projects that they're going to be delivering there around spirometry, cervical smears, helping with their infection prevention and control lead work. And also to support their roving team, who've had a huge focus on vaccination over the last few years, and supporting their work around their annual health checks. And actually, just listening to the previous presentation, I was sitting there thinking that those referral pathways would be something that we could add to our annual health checks that we do already. So that's a really good piece of work we can grow and develop. I'm working with the health equity team to support the long-term conditions work and priorities for that. And of course, part of this role is supporting the Children's and Young Persons Immunisation Coordinator with raising awareness and increasing the Children and Young People vaccination programme. So this is what I'm going to be talking to you a little bit about today. So if you could just move to my next slide for me. So as you'll already be aware, that there is an ongoing campaign around polio and MMR around the Newham area, particularly around last year with the polio that we were finding in the water system. The IMS coordinator for Newham, Sam, has continued to monitor your vaccination rates at all GP practices, and he works with those practices who are particularly requiring some extra support to increase their uptake. Unfortunately, as you know, this week, the UK Health Security Agency have announced that there's a potential for a serious measles outbreak. And I know that in a neighbouring borough for North East London, there is already 40 cases that have been documented and reported and registered. An email was circulated yesterday from North East London ICB from Moira, asking practices to prioritise MMR and polio vaccination to help to prevent a serious outbreak, and outlining some of the support that's been available to you. If you haven't read this email, I urge you to read it as soon as possible, because the sooner you read it, the quicker you can get things in place, and the quicker actually you can reach out to support from people like NHC if you need it. So if you just move on for me. So there are already some ongoing discussions to identify gaps in pathways or to support the need for further development between NHC, or the ICB, and Vaccination UK. If you've got anything that you've noticed in your own practices that you think that would help to increase uptake, anything that you thought to yourself, this could work much smoother if this was in place, or anything you're finding particularly difficult, please do contact me directly or go to Sam. The ICB have provided additional support for this work through Vaccination UK. They have been commissioned to offer call recall and vaccination. This service that they're delivering is across the whole of North East London. And at the moment, they're also in discussions. We are currently in discussions as NHC to see if there's anything we can do to offer them support, because I do know that they are struggling even before this outbreak has kind of been identified. So Vax UK are offering in-school and community vaccinations, which will be running over the summer holidays. Parents are also able to book these directly if clinics are unsuitable for them. So if you just move over to the next slide for me. Right, so this is a very brief just overview of what clinics are available on the Vax UK website already. At the end, I have got a list with a link page so you can see them yourselves. But this just goes to show that for parents that contact your clinics, if you're not able to accommodate the vaccination, you can signpost them to Vax UK website, where they will be able to either book the appointment themselves, which I've actually given it a go this morning, because I think one of the things you should always know is how easy is it to actually do. So I've had a go myself, and it is really easy. But there is also a dedicated telephone number should they not be able to complete the digital form. But also Vax UK have been quite clear that anybody that walks in and is eligible will be vaccinated there, and then they don't have to pre-book an appointment, which is great. If you just move on for me. So what does this mean for you as GP practices? So there are many ways that you can help to support this campaign. It's really vital that we can do this with your support. Firstly, by offering vaccinations to eligible families that your practice, who you're already in contact with, who contact you directly. But this in itself might cause a few little problems for you. So parents might be unsure whether their vaccinations are up to date. They might have lost their red book. They might have been included in the earlier polio campaign. So it's really important that you go through and check those records of those patients to make sure that they are eligible. If they've phoned you about one child, perhaps saying to them, have you got any other children that you've got in your home? Actually, what Will's just mentioned around the older adults, perhaps making a point of checking their vaccination records and seeing if you can do a bit of a capture to collect, to get all those patients in on one day. That would be absolutely brilliant. You might find that those parents are struggling with translation, and just to remember that there are resources available through Language Line. If you do need that additional support for families, you can contact them. You might also find that some unregistered patients contact you. And if that is the case, then please either, if you have capacity, to register them yourselves at your own practice and support them for vaccination. But if not, to get them to go via the NHS Find a GP website or the telephone number, so we can help to get them supported, registered and vaccinated. If you are in a position to do so, to increase your call recall work for children who've not yet been vaccinated of any eligible age would be absolutely brilliant. If you're struggling with capacity for the call recall work, please reach out to Sam, the local IMS coordinator. He has already had some surgeries who have reached out to him for support, and I know that he has gone back to North East London for some discussions around whether or not there is additional capacity to help support your surgeries, because that's the most important thing, isn't it, that we do manage to get these children vaccinated. So as I've just said, Vax UK have been commissioned by North East London to support the campaign. At present, they're really struggling with access to patient contact details of eligible patients. So the way they access their data means that they are reliant on the Child Health Information Service. And often there are wrong phone numbers that don't work, it's out of date, it's old addresses. So they are really struggling. So one of the pieces of work that we're looking at developing is NHC helping to support a call recall model to support Vax UK in Newham. So you might find that you find someone from Vax UK or NHC is contacting you to ask for some patient information. If we do that, there will obviously be data sharing agreements, and I'm asking you to return these timely to enable them to be able to contact these families as soon as possible. Over the summer would be great, because it's a good opportunity while they're not at school to capture these children. It is anticipated that this campaign will continue through the summer, and it will be reviewed again in the autumn, depending on how many children have been managed to be picked up during the summer period. If you're unable to vaccinate your 5 to 11-year-old patients yourselves, you can't make those appointments in clinic, again, signpost them to the Vaccination UK similar clinics. And finally, if you need any support with call recall or vaccinating your under 5 cohort as well as your over 5s, please do reach out to Sam, as he's also in a position to be able to take those conversations back to North East London to see if there's anything else supportive that we can implement. And just on my last slide, I've just put on here the contact details for the local campaigns, also the link there for Vax UK website, and my email and Sam's email. So I hope that was useful. Any questions?
Thank you so much, Cara. Again, there's a lot that you spoke about, and I think it's good to remind your practices, just, we are in this pandemic, or measles pandemic now, I would call it, pretty much. So it's just reminding sort of practices, and the tips are really helpful to kind of signpost and sort of go to patients, remind them, and all of that. So thank you. Any questions for Cara? No?
Thank you.
So helpful to put your details there, and I think if Steph can sort of send that round again, or we'll put it on the chat at least, so that people have your access to your email, and if there are any questions or concerns, they can reach out to you. Thank you so much, Cara. Okay, so last agenda items for today is around the Newham 50 steps refresh. So Claire's here. Welcome, Claire. Thank you so much for coming today.
Thanks.
Some brilliant work around this. So yeah, over to you.
Great, thanks so much. Hi everybody. I'm Claire Greszczuk. For those who don't know me, I'm a consultant in public health in Newham's public health team, currently acting as Deputy Director of Public Health. Steph, have you got my slides up there, or should I share? Oh, you've got them. Okay, thank you. So basically, I'm going to talk for hopefully about 5 minutes, and I would really like the rest of this session to be a discussion. And I have a Jamboard for anybody that likes Jamboards as well. So the purpose of this is about raising your awareness of 50 steps, so basically telling you what we're doing, and listening to you basically after that. So we have lots of meetings with lots of managers in different areas, but what we're really trying to do is really reach clinicians and people who are working out in communities to get you involved in developing the new strategy and hearing from you about what you see as the main priorities. So that's what this session is all about. If we just go on to the next slide, please. In terms of just a little bit of background for anybody who doesn't already know, the Newham Health and Wellbeing Board have a health and wellbeing strategy called 50 Steps to a Healthier Borough. And it has 12 priority areas, which you could see on the screen there. So it basically tries to take a really comprehensive whole system approach to improving health and addressing health inequalities. And if we just move on to the next slide, just a bit of a flavour on the next slide, that's the one, thank you, of some of the sort of the activity that's happened over the second year of the strategy. Loads and loads of stuff delivered, lots of it very much evidence-based for improving health outcomes across a really wide range of areas and interventions. So you can see up there on the left a huge number of polio vaccinations delivered during that campaign, all the way down to the way that we're supporting migrants and getting people more active and so on. So loads of really brilliant work. It's very much a partnership effort. I'm from the public health team, but we always try and say it's absolutely not our team delivering this. This is being delivered by people across the system. And that's really what our vision is for the next version of the strategy. So if we just go on to the next slide. So the next version, so currently we're calling it 50 Steps 2.0, and it's basically going to be building on all of the progress so far. So the kind of overarching purposes around improving residents' health and reducing health inequalities. And with that holistic focus, so to thinking about what are the really priority actions that we can take as a system at the level of individual people, individual patients, community approaches, all the way up to things that we can do to influence the conditions that people live in, their homes, the transport environment, and employment, and so on. And so if we just go on to the next slide, please. So the aim of the project, so we've got until April next year to write the strategy and publish it. And so in doing that, our objectives are firstly to develop a strategy that firstly is underpinned by evidence and data. We've got a lot of challenges in Newham, and one of our real kind of difficult things in writing the strategy is thinking about what are the priorities, and we're going to use data to do that. But then also that kind of the co-production, so hearing from people like yourself and also from residents and community organisations about what are the priorities from your perspective and what are the things that we can do either in our own organisations or in partnership to address those issues. And we've got a new context since the last strategy was written. We've got a new ICS structure. We've got a new council corporate plan and lots of other different priorities. So the new strategy will be a really nice opportunity to just sort of reflect and align with where where the landscape lies in Newham. I think the second objective there is one I just want to touch on, is that in the process of writing the new strategy, it's a really good opportunity for all of us to kind of talk to each other, basically, and build some momentum and get some enthusiasm around what we're trying to do here. It's not just a sort of tick box exercise. We need a new strategy, so let's write something down on paper. It's very much about getting that, the sort of involvement from everybody and thinking, what can we actually do that's going to make a difference, and building that momentum to then deliver the strategy. So if we just go on to the next slide, these are just very quick scene settings. So big picture in Newham, healthy life expectancy for women is 65-ish years and men just under 60 years. For men, that's the lowest in all of London. Women are around sort of average. And one of the key implications of this slide, it's super big picture, but basically it shows us how many years residents can live in poor health, and the implications of that for their own well-being, but also services and demand on services. And then the next slide is just showing the inequality. So again, we talk about inequality a lot, and we can think about inequality in a whole range of different ways. One way is to say, well, how does Newham as a place compare to other places? And when you compare Newham to the most healthy part of London, we can see that there's differences in life expectancy between those who are living in Newham and other parts of London. But actually, really interestingly, and I hadn't actually appreciated the scale of the difference in life expectancy within Newham, and looking at the data for girls, there's around 6.5 years difference between girls born in the most deprived areas and girls born in the most wealthy areas of Newham. And for boys, it's even bigger, it's 8.1 years. So what that says to me, and the reason I wanted to mention that here, is that we think of, we think of Newham in different neighbourhoods, and in different places and different practices. And I think it's really important for us all to think about the fact that we have this inequality in our system that we can try and address through the way that we target those groups who are most deprived or most in need. And on to the next slide. This just demonstrates a little bit of data around diabetes and the geographical spread, making that point about the fact that we can use data to help inform our services and our planning, but also that there are these sort of differences across Newham. And then the final slide, just bringing it down to the practice level. So this is an example of a slide that you probably have seen for your own areas, which is a snapshot of again, the example of diabetes. We can see that there are differences in different parts of the borough and between different practices in terms of your population's levels of diabetes and the change. And this is obviously just diabetes as an example, but I thought it was useful to kind of highlight some of the context we're working in and what that means for what types of things as a system we could consider around the way that we address some of these big issues that we're all facing. So if we just go on to the next slide, please. So I'm almost done presenting, and then I want to hand over to you. I don't know whether this is at all useful or interesting or relevant to you, but I kind of feel like we often, when I'm talking about 50 steps, I often feel the need to sort of say, well, what's in it for you? Like, why get involved in this piece of work and take part in delivering the strategy? And so this is my thinking, and we very much want this to be a partnership. This is about doing things together. It's not about individuals having to feel hugely responsible for taking action all on their own. But primary care is absolutely essential. It's one of the most essential parts of the healthcare system in terms of improving people's health and addressing inequalities. And so we want you to be part of setting that vision. Where is primary care now in Newham, and where do you want to be? And then we can give a clearer voice to that in the strategy. So one of the things that we're planning to change from the current version of the 50 steps to the new one is to give a much clearer articulation of healthcare and what we want to do as a system on healthcare, and primary care needs to be kind of completely front and centre there. and making sure in what we write that we're really aligned to the wider system. And then once we've done that, it's about then driving change. So by sort of locating actions in the strategy, we can really drive forward that delivery in partnership. And we can also, what we found in the current version of the strategy is that one of the really impactful things it's had is just bringing people together. So we've formed partnerships and ways of working that help us to collaborate and amplify our efforts. So that's another sort of benefit of being involved in implementing the strategy. And also what we'll be doing is setting KPIs and outcome indicators, so we can all have a sort of a shared set of outcomes that we're looking at and helping us improve, and then using that to continually improve. So that was my sort of sense of why bother to take part in this and get involved. And if we go on to the next slide, so I wanted to pose a few questions, and I've got a Jamboard. I'll put the questions in the chat as well, really to get your thoughts. So what are the key problems that you want to solve, and really importantly linked to that, what might help get us there as a system, building on what's already happening. So it's not about trying to come up with a whole new set of priorities or a whole new set of things that we need to do. Nobody's got the money or the time for that. It's about what are the big things that we want to focus on and really put up there as the priorities that as a system we can then tackle together. And then as part of that, what's already working well and what could improve. From that, can we identify any tangible steps? So things that we could really put in the strategy and say, we are going to do this, and this is how we'll measure it. This is what we expect to get out of it, but that are realistic as well. So again, coming back to the point, this isn't about trying to do a whole bunch of new stuff. And what we want to be much clearer on in the new version of the strategy is about that sort of the roles and responsibilities. And so your advice and your insights and your feedback around who needs to be involved is very, very valuable. And then the final point I'll make before moving on to the very last slide is about golden threads. So in what we'd like to do in the strategy is weave through the 3 golden threads of equity, climate, and inclusive economy. The reason we've chosen those, I think equity goes without saying. We want equity to be embedded in everything we do. But the other 2 are areas that have massive health impacts, and we can deliver real co-benefits on. So we can improve the climate by reducing car use, and that brings about improved physical activity and improved health. So that's why we wanted to put them in there. And I think primary care has a role in those, particularly around climate. There's a huge amount going on in the NHS, the ICS Green Plan, and so just if anyone has any thoughts about how you are sort of already working on those areas that we can kind of reference, then I think that would be really valuable as well. And then the final point to say, and I should have said at the start, I was supposed to be jointly presenting this with Wax, but really sadly he's not able to be here. And so the final slide, if we just move on to, is Wax's sort of initial thoughts around a bit of a primary care strategy. So we're not necessarily starting from a blank page here. I know you've all got ideas, you've all got your own priorities, and then this is something that Wax had thought about to try and organise some of those ideas. So maybe what we could do is we can maybe take the slides down and have a discussion. And if you would like to, I'd really like to hear what people's thoughts are. And I'll also put the Jamboard link in the chat so that if you'd like to type in, you can type stuff on the Jamboard, or you can just type it into the chat as well. And we'll capture it all for the strategy. So yeah, over to you.
Thank you so much, Claire. There's obviously a lot in there, and really important to emphasize is a partnership approach, especially with kind of delivering this plan. I guess some of the issues that we have within primary care, we are, as we all are across the partnership, but we're extremely busy, and it's about identifying those particular individuals who either have an interest in this or who, through their clinical lead roles, are already involved in some of this work, and how we then drive that forward, because it's very difficult in our consultation time to think about all these different things and using and capturing that time that we have with the individual to start thinking about how we can create some of these changes. And I think Wax's slide is actually really helpful to try and, compartmentalize things in a way so actually we can actually think about, okay, we can achieve these things actually together. I'm going to open it up to anyone who has any comments and suggestions. And I think, Claire, it'd be helpful just to say who you're linking up with already, because then we know within our primary care sort of team who is actually linked in with things.
Yes. So the main people, so Wax and myself, Karen, I've got it's what's his name? I'm sorry, I've forgotten, but I need to get in touch with somebody from NHC. And then Tammy was very keen she had a lot of ideas in the meeting we went to recently. So basically at the moment it's Wax, Paul, isn't it? And Tammy.
Okay. And Kat, in terms of our
yes, sorry,
perspective from the green. Okay.
Yeah.
So I mean, obviously that's not enough to really look at this strategy. I mean, it's not enough. So it's about how can we all work together and try and engage primary care better. Any questions, comments from anyone? Karen?
I just wondered, Claire, what's your timelines for colleagues? Because I think they would probably want to digest, have a bit of reflection and maybe feed into you. And it just, we can definitely encourage, and we'll do a newsletter after today with links and information, but it might be good to say to them, if they can feedback comments by a specific point. I think that feels helpful. Yeah.
Absolutely. So the idea is to have an early draft of the strategy ready by early September. So any ideas, what we could say is if people would like to feedback particular ideas by mid-August, they'll make their way into the early draft of the strategy. But what we'll be doing is refining and further sort of developing the strategy between September and around November, December time. So there'll be much more opportunity to feed in later. It's just that any ideas that get in there before September will be there then when we'll take the draft to the Health and Wellbeing Board and to the Health and Care Partnership and places like that. So as early as, if we say mid-August, then that's great from our perspective, but there's definitely more opportunity after that.
Okay, thank you, Claire. That's really helpful. And any comments, obviously, we'll feed back to you, or they can feed back to you directly, or via sort of Karen and Paul as well, and Wax. So yeah, thank you so much. If there's no other questions or comments, yeah, that's fine. Thank you, Claire, so much for that.
No problem, pleasure. And I'll leave the Jamboard open, so if anybody wants to just stick stuff on the Jamboard, then please go for it. I'll put my email address on the slide, so it's all in one place.
Absolutely. And I think Claire's comment was kind of sharing this on the WhatsApp group, and I think that's a good idea. So we'll try and do that as well. Perfect. Thank you so much, Claire.
Thank you. Thanks for having me. Bye.
Okay, that was our last agenda item. So is there any other business that anyone would like to come in? Karen?
Rima, I was going to say, I think Claire Davison, did you have a short update, or have you already covered it? I know.
I know, I'm actually on the stairs trying to get reception. I
was going to say, you do look like you're in a bit of a dark.
Sorry. Yeah, I've been struggling with my laptop. Yeah, no, I think we just wanted to raise the opportunity for some fellowships, but I guess one of the reasons I made that comment about the last item was that I just think the attendance here is quite limited today, And I'm not sure if people here might be able to raise it within GPs within their practice, or whether actually we need to start using the WhatsApp to access the wider GP community. It's just that we know that there's just such an issue. We've got such a young population, and we have very high attendances in the urgent care system from young people and their parents. And it isn't just explained by the percentage of our population, the profile of our population. It does seem to be disproportionate. So we're really looking for a couple of GPs to get involved with the system for 2 sessions a week. So one would be working within the service, and one would be developing some leadership skills or audit skills or service development skills within the paediatric service. And I know that the hospital paediatricians are very keen to have some young GPs involved with this. I know the management and the service and commissioners are very keen, the lead commissioners. I'm very keen. I think we had a big introduction of sort of younger GPs into the leadership structure about 10 years ago, and I think there's a real need to start bringing more in. I know that there have been a few, but there are opportunities with fellowship. So if we could get the information out there, we're hoping today there would be a higher attendance. So it might be we need to do this via some other groups. I don't know if maybe we can talk about this offline, Rima.
Yeah, I mean, I think it may be worth putting it on the WhatsApp group, because we know that there's sort of so many sort of GPs on that group. I think there'll definitely be sort of some interest in there with the younger GPs coming through. So yeah, my suggestion would be to definitely put that on there. We could put it on an MS Teams link within NHC as well, maybe.
Okay.
Because people do kind of access that. So
and maybe in the newsletter, Karen, or I'm really, I'm just very keen. I think that there are specific skills with leadership, particularly when you're interfacing with commissioners and services and other providers, and it's trying to bring some younger blood in and sort of give them that sort of mentorship and that development. And there's a lot of exciting stuff happening in urgent care that's really exciting with children and young people. We will have some other services this winter, I'm sure. So there's lots of opportunities to develop that additional side, and it might help with the retention that was raised earlier when we had the really good item at the beginning on training.
And if there is anyone on this forum that is interested in that, you can directly sort of email Claire, I presume. Claire, is that okay? So, if they're interested in it, but we'll also put it on the WhatsApp group, because I think that'll be helpful. Perfect.
Okay.
Thank you. Any other business from anyone else? No? Okay, well, thank you all for your time today. Have a lovely weekend. And for those who are jetting off somewhere, have a nice time before the next GP forum. Okay, take care. Bye.
Thanks, Rima.
Thank you.
Cheers, colleagues.
Thanks
Bye.
all.